is Elise Nouvet. I'm a medical anthropologist and an assistant professor in the School of Health Studies. And thank you very much for joining us for the second webinar in the series Methods for Global Health Equity. I'm co-hosting today with Leanna Matthews, who is a student at Western. And I just want to, before we get started and before I hand things over to Leanna to introduce our guest speaker today, tell you a little bit about this webinar series. As well as the Canadian Coalition for Global Health Research. So first of all, this webinar series is a collaboration between Western University and the Canadian Coalition for Global Health Research and the Western chapter of the coalition. And for those of you who may not be familiar with the Canadian Coalition for Global Health Research, it's a knowledge network that brings together researchers and trainees and young professionals and students from across Canada. There are 25 member institutions. There are young professional and student groups across the country. And there's also members across the world of the coalition, with the commitment of the coalition being to promote and support equity in global health with a focus on research. So they are co-organizers of the Canadian Global Health Conference every year. They are the authors of the widely used principles for ethical and equitable research. And in the past months, we've been active in developing and issuing statements that have been widely cited in the Globe and Mail and the Washington Post on vaccine and equity and kind of working against vaccine nationalism. So I encourage you, if you want to refer anybody to the archived video for today's webinar or the past webinar, it'll be on the CCGHR website. We'll put that up later on. And you can also check out the work going on there. So Methods for Global Health Equity. This is a webinar series that really is the vision and has been drawing on a lot of energy from students at Western who have identified a need and have an appetite to learn more about what goes on behind the scenes in terms of global health. So at the core of the webinar series is a recognition that in global health, when we want to work equitably, work ethically, it's not enough to be careful about where you're working or what your topic is. You also have to really examine your methods and how you're working. So methods in global health are playing a major role in either advancing or hindering equity objectives, and that really is our point of departure. And within that as well is a recognition that research is ultimately about relationships. And so this webinar series is looking at the success and challenges of research and how those have to do with the particular context, the way in which methods align with that context, the way in which those who are involved in leading research have particular positionality or relationships to topics, to context, to participants. And we're taking a closer look at the ways in which research projects are articulated to local needs, but also expectations, desires, past histories of intervention, past histories of representing need and what progress or change would look like. And also, this is a webinar series about lived experiences. So lived experiences of researchers and lived experiences, of course, of those at the heart of our research, who are the communities we engage and our participants, of course. So we can't really talk about supporting or committing ethical and equitable global research if we don't talk explicitly about how we're working. So I'll pass things over to Leanna, but first I do want to offer a land acknowledgement. So I myself am born in Ottawa, which is Algonquin territory, and I speak to you today from the city of Hamilton, which is traditional Anishinaabe, Mississauga, Haudenosaunee, Neutral, and Huron-Wendat territory. On behalf of the Western community, I'd like to acknowledge the presence of the University and the City of London on the ancestral lands of the Anishinaabe, Haudenosaunee, Lepanawak, and Arawandran peoples, as determined by the Dish with One Spoon Treaty. The land continues to be the home to traditional Indigenous peoples who are contemporary stewards of the land and critical contributors to the Western community and to society. And I'd also like to acknowledge historical and ongoing violence and inequities lived by the Indigenous occupants of the territory currently called Canada, and reaffirm findings from the 2015 Truth and Reconciliation Commission that there remains a lot of work to be done to decolonize higher education and ensure spoken commitments to respecting Indigenous knowledge and peoples gets reflected in our day-to-day interactions and structural change. So without further ado, we have a great speaker today on a topic that I know is going to resonate with many people here. I'll pass it over to Liana. Thanks.
Hi everyone, and thank you, Dr. Neve. So for those of us that just joined the webinar, hello and welcome to session 2 of a 5-part series titled Methods for Global Health Equity. My name is Liana Matthew, and I'm a third-year student at the University of Western Ontario studying medical sciences. I'm part of the CCGHR chapter here at Western. I've been working with the team and Dr. Neve to bring together very knowledgeable and distinguished professionals in the field of global health to speak during this series. So on that note, I'd like to introduce our speaker for today. So Tanya is an occupational scientist and therapist. She completed her PhD in health and rehabilitation sciences in the field of occupational science from Western University in 2019. Her research interests are underpinned by critical paradigmatic values and broadly encompass working alongside children and youth experiencing marginalization within local and global contexts through participatory and creative methodologies as means to address social change. She has published articles addressing participatory action research, creative and digital methodologies, occupational justice, childhood disability and rehabilitation, and children's participation. Additionally, Tanya has been involved in social innovation work, addressing global mental health challenges, as well as contributing to scholarship on critical and ethical global health research and practice. She was a recipient of the Ontario Trillium Doctoral Scholarship. Okay, so before I hand it off to Tanya to start her presentation, as Dr. Neve mentioned, if you would like a certificate of attendance for today's webinar, we do have a quiz that will go live after today's session. And if you complete it successfully, we will award a certificate of attendance, which will be sent via email within 2 to 3 days. I will input the link for the quiz in the Zoom chat right now, and I will also input it at the end of the meeting for anyone that joins late. Okay, so on that note, Tanya, the floor is all yours.
Thank you, Liana. Hi, everyone. I'm gonna quickly share my screen. So today I'm gonna be talking about participatory action research that specifically utilized participatory filmmaking with children with disabilities in rural India. So a quick outline for today's presentation. I'm going to first be defining participatory action research, specifically articulating what participation and action stand for. Then speak about the paradigmatic underpinnings of PAR, specifically situating PAR or participatory action research within the critical paradigm. And then I would define participatory filmmaking and then make explicit how these terms, research approach, methodology, and methods are situated within this work. And then finally, I will share a little about the participatory action research with children with disabilities that was carried out in rural India. And within this work, I would position myself, speak about the research background, objectives, again, some paradigmatic and theoretical underpinnings, the research phases and activities carried out within each phase, findings, some challenges and how these challenges were navigated, and then end with a conclusion. So what is participatory action research? So as the name suggests, it embodies 3 elements, which is participation, research, and action. So understanding participation. So participation within PAR ideally stands for equitable collaborations of community members in all phases of the research process. So does that mean that community members need to be involved in all aspects of the research? Not necessarily, but they need to be given the space to make decisions on what aspects of the research they would like to be involved in. And yeah, so just give me a second. Yes, so they need to be given the space for what aspect of the research they would like to be involved in and created a space for them to do so. Understanding action. So action is seen as a continuum, which can range from the raising of critical consciousness to actual changes in practice, social structures, institution policies through the development of programs. So I'm not going to go into too much detail within the slide, but I do want to highlight that PAR, or participatory action research, is situated within the critical research paradigm. Within this paradigm, research always seeks to dismantle unequal power relations. So researchers and community members are involved as co-researchers within this work. It seeks to enact an agenda for the emancipation of the oppressed. So that is research within critical paradigm, or research that embodies critical paradigmatic values always embodies an agenda for addressing situations of injustices. And it also seeks to change systems rather than focusing on individuals and fixing individuals, but rather focusing on the contextual forces that actually create and perpetuate situations of injustices. Participatory filmmaking is defined as a collaborative process where community members use cameras to document, explore, and critically engage with social issues through the process of creating a film that communicates information, reveals hidden social relations, and stimulates collective action. So within the scope of this work, participatory action research is situated as a research approach within which participatory filmmaking is utilized as a research methodology. And within this methodology, various methods were used, such as capturing videos, interviews and group discussions, as well as guided walks. So what do I mean by a research method and research methodology? So a research method is often referred to procedures that are used to generate data or generate information. And when a method is underpinned by specific theoretical underpinnings or specific theories, it is referred to as a methodology. So within participatory action research, various methodologies and methods can be used, such as photo voice can be another methodology that can be used within PAR. But within the scope of this work, we used participatory filmmaking. So moving on to the project, Participatory Filmmaking for Transformative Research with Children with Disabilities. I would first like to position myself within this work. So within any critical research, it is important for a researcher to position themselves within this work and speak about where did this research interest come from. And here I'm also going to speak about why did I choose India to do this work. I completed my professional degree in occupational therapy in India, and after which I worked as an occupational therapist within a community-based rehabilitation program for children with disabilities within various rural villages in southern India. And it was during this time that I was sensitized to situations of injustices that children with disabilities often experience, that is them being denied opportunities to participate in activities that were meaningful to them within school, at home, as well as in the community. And based on these experiences, I was interested in working towards addressing such injustices, but working in collaboration with children in a participatory fashion. This project was also carried out in collaboration with a local institution where I completed my undergraduate degree. So I had prior established relationships, as well as was familiar with the context, the language, and the culture, which formed a really good foundation to carry out this participatory action research for my PhD work. So moving on to some background. So this research is situated within the discipline of occupational science. So occupation is broadly defined as the everyday activities that individuals and collectives need and want to do. And occupational participation has been described as a key contributor to well-being and societal inclusion. However, various contextual forces like economic forces, socio-cultural, and political forces can create barriers to occupational participation, leading to situations of occupational injustices, which is actually defined as when communities or individuals are barred or hindered from participating in occupations that they need and want to do. It's defined as an occupational injustices. Children with disabilities often experience situations of occupational injustice, and this risk being greater among children from low-income rural communities, especially within the global south. So a little about disability within the Indian context. India is a very multicultural, multi-ethnic, as well as a multilingual country. And dominantly literature on disability within an Indian context highlights how people with disabilities are often situated as invisible within this culture that valorizes perfection. Parents of children with disabilities always hold on to an illusion of complete recovery for their child. And if this recovery was not obtained, the impairments of the child become their defining character, which lead to issues of stigmatization. Additionally, dominant religious beliefs often associate disability as something evil, something of lower status, a curse or a karma that is a retribution for past and present sins. So these dominant beliefs, along with stigmatizing discourses, often lead to situations of marginalization of children with disabilities, within the home, school, as well as the community. And this marginalization also extends into research, where perspectives of children with disabilities are seldom heard, and their experiences are often heard from perspectives of parents, service providers, or other community members rather than children themselves. So in turn, there have been numerous calls for involving children with disabilities within participatory work, as the United Nations Conventions on the Rights of a Child articulates that all children, irrespective of age or ability status, needs to be involved on decisions that matters them. So this research, again, was situated within the discipline of occupational science. And within occupational science scholarship, there have been increasing calls for a scholarship that is critical, that's reflexive and socially responsive. Dominant literature of this scholarship is often dominated by Western, middle-class female, Anglophonic, able-bodied adult perspectives. And if we want our discipline, that is the discipline of occupational science, to be international, diverse perspectives need to be gathered through methodological pluralism, acknowledging different ways of knowing, which in turn can promote or further mobilize occupational science as an international and a socially responsive science. So moving on to the broad purpose. So the purpose of this work was to respond to disciplinary calls for socially transformative research within the discipline of occupational science through methodological pluralism. And the key objectives of this work were to work with children with disabilities as co-researchers in exploring their firsthand perspectives about their lives and what mattered to them and what they would like changed both for themselves as well as their communities. It also sought to explicate the situated nature of their experiences and how they were shaped by context. And it sought to work alongside children as well as community stakeholders in addressing change. So again, it is important to situate any research within a specific paradigmatic and theoretical underpinnings. So as I articulated earlier, this research was situated within the critical paradigm that highlights inequalities or situations of injustices as shaped by unequal power relations. It also sought to challenge the dichotomy between researchers and community members, but sought to embrace community members or involve them as co-researchers, and it worked towards addressing situations of injustices through addressing contextual forces rather than fixing individuals. It broadly, specifically also utilized Freire's work on critical pedagogy. So Freire is a Brazilian educator and philosopher who focused or articulated the need for shared dialogue as means for the raising of critical consciousness, which in turn would guide social transformation. This work also was informed by critical disability perspectives that sought to challenge the dominant and negative taken for granted assumptions regarding disability, as well as the critical occupational science perspective that highlights how occupation or occupational inequities are situated within unequal power relations. So moving on to the different phases of this work, there were three different phases: the preparatory phase, the participatory research phase, and the action phase. I will describe each phase in detail within the next couple of slides. So in the preparatory phase, it was during this time that I traveled to India, and I worked to strengthen local collaboration, that is work with the local co-researchers or local collaborators on the field by speaking to them about what is participatory action research, what are the central tenets, what are the principles of PAR. And then we also sought to collaboratively establish roles within this project, as this project was carried out in collaboration with a local institute in India. And this institute worked with 85 different villages. So we had to also identify which village we could do this project in, which was based on the number of children with disabilities that were identified within each village, and also which village had the space for this kind of work. It was also during this phase that I sought to identify potential volunteers to be involved in this work. So we were looking for either a photographer or filmmaker who has the skill sets to train children in these camera related skills to be involved as volunteers. So within the scope of this project, a local photographer was initially involved as a volunteer, but later he became a co-facilitator and was involved throughout the process. Once the village was identified, recruitment was mobilized through a local village health aide through using culturally relevant posters. So she handed these posters out, and people who were interested were invited to a recruitment meeting, which was also held within their village. And then it was also important for us to select what kinds of equipment we needed for this work. So once ethical approval was obtained, it was when the participatory research phase actually started. And it was during this phase actually sought to enact the key principles of participatory action research. That is, it worked to share and negotiate these power differences and involved children with disabilities as co-researchers. They had the space to make key project-related decisions, like they were given two options of methodological choice and they chose one. And they also had the space to make key decisions about what were the topics they wanted to explore and address within the scope of this work. So in terms of rapport building, I want to highlight that within this context, power differences between adults and children were common, in that children were often not provided the space to either speak up or challenge the view of adults because it was considered disrespectful. But if we wanted to involve children as co-researchers, we needed to work towards balancing some of those power differences. And so I played a lot of culturally relevant games for them, like cricket, music, dancing, hide and seek, and all sorts of games that facilitated working towards balancing some of those power differences, although these power differences cannot be balanced, but just working towards addressing some of those differences and to involve children as collaborators. So children also took the lead role in identifying issues. So since we wanted to speak about occupations or the everyday activities that people did, occupation wasn't a construct that was easily translated to the local language. So we had to use a lot of culturally relevant visuals, as you can see here. We had to draw some of these visuals specifically for this project to facilitate the conversation on everyday doing. So children used those visuals and engaged in a lot of activities to identify as well as prioritize issues that they wanted to address within the scope of this work. Training was also a key component. So children were involved in training related to camera use, as it was the first time many of them were using a camera. We also engaged in a lot of conversations about research ethics. What does it mean to gain consent? What does it mean to address visual ethics? So we also made a key decision early on within this project that the visuals that were going to be captured were going to be unidentifiable. So children were again practice ways to capture visuals that were in a way that did not reveal any identifiable information of people involved within their screens. So once children started identifying issues, the video making process started in that. So children, once they identified issues, they went out and captured videos addressing some of the issues they identified. Then they came back and watched all the videos that they captured and engaged in shared reflection and dialogue about what do you see here, what is really happening, how does it relate to our lives, and what can we do to go about addressing such issues. So these shared reflections and shared dialogue help them explicate some of these issues and think about what are the causes of these issues and how they could actually go about addressing change. And once they had shared reflection, they went out again and captured more videos, and then they came back and again engaged in dialogue, so that we had approximately 35 discussions with children. And this and once children captured videos, they worked with me in editing the film. So I again trained them on what are some basics of video editing. So they worked with me in collaboratively editing this film. And this phase ended with the dissemination. So we disseminated the film to the local village health leaders, the local institution through which the project was carried out, and children also called for disseminating the film on YouTube more virtually. And wrapping up was also an important piece of this work, as relationships were built, and it was important for children, the child co-researchers, to understand that this project was coming to an end and what that meant for each one of them. So there was some time left to intentionally wrap up this work. So participatory thematic analysis specifically refers to the process of filmmaking. So that is the shared dialogue and reflection that children engaged in. And these themes that are presented here are the key themes that are also presented within the film that they have created. So they specifically spoke of all the occupations that they desired doing, but also highlighted what were some barriers to their occupational participation, such as issues related to violence and child trafficking that was prevalent within the community, which actually caused parents to prevent them from going outside or playing alongside their peers. They also spoke of issues of occupational justice, where they specifically highlighted how they were marginalized within their schools, where teachers prevented them from participating in extracurricular activities like cultural programs, sports activities, because of their negative perception of the child's impairment or need. Apart from individual issues, children also spoke of larger community-based issues, such as interrelated issues of violence and substance abuse. So specifically speaking about how children with disabilities were teased and bullied within the school as well as community settings. They also spoke about issues of substance abuse, not only by adults within the community, but also by young children within the community. They also spoke about environmental concerns like deforestation and issues of garbage accumulation that impacted what they could and could not do, as well as health and well-being of the community members. So I'm going to quickly share a 3-minute clip of the video that the children created, and we can continue discussion after.
In school வந்து கன்னடிஸோட புட்டி அமைதியா சொல்றாங்க என் கண்ணாடி தூக்கி போடுறாங்க இனி அது குறி வச்சு கிண்டல் பண்றாங்க கேலி பண்றாங்க எப்போடா அடா காக்கா அப்படி திட்டுறாங்க அப்படியே கும்மு கும்மு குத்துவாங்க
ஒண்ணு பேசிட்டே இருக்காங்க பொட்டன்னு வாங்க அப்படின்னு ஏதோ பேசுவாங்க சும்மா நடந்து போயிட்டு வேணுமனே கலது ஏதாச்சும் ஒண்ணு பண்ணுவாங்க தூக்கி போட்டு அவனுக்கு பாட்டு ஏன்னா ஒண்ணு திட்டுவானுங்க
டீச்சர் கிட்ட சொன்னா கூட எதுவும் கண்டுக்க மாட்டாங்க அப்படியே போயிடுவாங்க
அவங்க கேட்குவாங்க ஏன் இந்த மாதிரி பண்ண அவ்வளவுதான் விட்டுருவாங்க அடிக்கிறதுல விட்டுருவாங்க கேட்டுட்டு மாட்டேன் ஏன் இந்த மாதிரி பண்ண இனிமேட்ல பண்ணக்கூடாது அவ்வளவுதான் சொல்லி விட்டுருவேன்
போன வருஷம் படிச்சு போது என்னை தனியா உட்கார வச்சாங்க அப்போ வந்து நீ மார்க் எடுத்தா கூட நீ நல்லா படிக்க மாட்டேங்கிற ஓரம்பு கொஞ்சம் அது
இவங்க பாரு எப்படி எழுதிருக்காங்க இவனும் இருக்கானே தந்தாக்கு ஒழுங்காதான் ஏறல
ஸ்கூல்ல ஆண்டிவி அது மாதிரி எதுவுமே சேர்த்துக்க மாட்டாங்க. ஏன்னா கண்ணாடி விழுந்துட்டா அது மாதிரி சொல்றாங்க. ரன்னிங்கு நாடகம் டான்ஸ் அது மாதிரி சேர்த்துக்க மாட்டாங்க.
ஒரு விஷயத்துல நான் வரேன்னாக்கா நீ வேண்டாம், மற்றவங்களை கூப்பிட்டுக்கோங்க, நீ ஒழுங்கா பண்ண மாட்டேன் சொல்லிட்டு சொல்லிடுவாங்க.
டான்ஸ்க்கு பிரயோகம்க்கு வரும். ஆனா நான் வந்து சேர்ந்துக்கலான்னு நம்பிக்கையில இருப்பேன். ஆனா அது வந்து அவங்க படிக்கல, நீ வேணா ஓரம் நிகழ்ச்சி வச்சிருவாங்க.
ஏதாச்சும் ஃபங்க்ஷன்னாக்கா அதுல லீடரா ஜட்ஜா அதுல அது அவங்க மனசுக்கு பிடிச்சவங்க அதுல போய் கலந்தவங்க மட்டும் அதுல போயிட்டாங்கன்னா கலந்த மட்டும் எங்களோட இருப்பாங்க. நான் கோச்சிங் போய் முன்னாடியில கோச்சிங் இருப்பேன். இந்த கண்ணாடி வச்சு போட்டு எனக்கு கொஞ்சம் கஷ்டமா இருக்கு, காட்டிக்க மாட்டேன், கஷ்டமா இருக்கு. இந்த ஸ்கூலுக்கு நான் வரமாட்டேன், அன்னைக்கு நான் இதான் இல்லை எனக்குக்கா என்ன தோணுதே நீ உட்கார ஏஞ்சிட்டேன் நான் உட்கார அப்படின்னு கண்ணாடி ஏஞ்சிடா அப்படின்னு இருக்கா. இன்னொருத்தவங்க கிண்டல் வச்சா கூட பிடிக்காது. குள்ளமா இருக்கிறவங்கள கிண்டல் பண்ணுவாங்க. அது வந்து குள்ளமா இருக்கேன்னு சொன்னா அதுல வந்து கெட்ட வார்த்தை சேர்ப்பாங்க. இந்த வாய் பேசுனாக்கா அவனுக்கு காத்து கேட்காது, அதனால கிண்டல் எடுக்கிறாங்க. அவன் எதுவும் திட்டுவாங்க, எனக்கு கேட்காதுக்கா அது எதுதான் சொல்லுவாங்க. அது ஊமை அது மாதிரி சொல்லுவாங்க. நான் எதுவுமே பண்ண மாட்டேன், கேட்டுச்சுன்னா அடிவாங்க. அவங்க கிண்டல் பண்ணுவாங்க, கண்ணாடி போட்டா கண்ணாடி போட்டு வச்சுட்டு கேட்குவான் நான் கூட திட்டுவானுங்க. அதுக்கும் பதில் திடீர்லாம் அடிச்சிடுறேன். அவங்க அன்பா சொன்னா கூட கேட்க மாட்டாங்க. உங்க அப்பா கேட்ட எடுத்துக்குவாங்க. யாரா கேட்கறதுக்கு எனக்கு நான் யாருன்னா அடிக்கிறேன் என் தம்பி இவன் அப்படின்னு சொல்லி சமாளிச்சிருவாங்க. நான் கிண்டல் அடிக்கிறேன், நீ தாண்ட கிண்டல் ஆச்சு அப்படின்னு மத்தவங்க மேல போய் போடுவாங்க. அவன் தான் ஃபர்ஸ்ட் எனக்கு கிண்டல் ஆச்சான் அந்த மாதிரி சொல்லுவாங்க. தண்டனை கொடுங்க, அவனுக்கு பண்ணா எப்படி இருப்பாங்க அவங்களும் யோசிச்சு பார்க்கணும். அவங்க கிட்ட எடுத்து சொன்னா அப்படி கூட புரிஞ்சுப்பாங்களா புரிஞ்சுக்க மாட்டாங்களா அவங்களோட பொறுத்து இருக்குது. கிண்டல் அடித்தா விளைவு எப்படி இருக்கும்?
Children not only spoke about some of these issues, but also spoke about what are some causes of these issues, as well as how we could go about addressing change. So before I speak about the action phase, I just want to point out that a link will be shared in the chat box to the full video or the full short film that the children created, which is approximately 12 to 15 minutes long. So if any of you are interested, you can watch that at a later point. So the action phase was the final phase of this research, and it is an ongoing phase. So children actually proposed community programs such as tree planting programs within the community, as well as they wanted programs such as garbage sorting activities. They also called for sensitization programs addressing the teasing and bullying of children with disabilities. And some of these programs actually have been already initiated by the local institution in collaboration with the village leaders, as well as with some local community-based nonprofit organizations. Children also challenged some taken for granted discourses about their positioning within the society, where children with disabilities are often positioned as incapable, and someone of lower status. So children with disabilities through this work position themselves as social actors and as responsible citizens by articulating issues that mattered for themselves as well as their community. They also sensitized community members to a lot of issues such as garbage accumulation, issues related to deforestation, which some village leaders hadn't even seen within their village. A lot of public wells were filled with garbage, which were more interior to the village. And a lot of people who watched the video articulated and shared how this was new information to them, and that they were also stirred to act to addressing some of these issues. And through working towards social transformation, there was also personal transformation of all child co-researchers involved, as well as the facilitators involved. Karthi, one of the child co-researchers, shared, "Before, none of us spoke that loudly or openly. but now we have gained some courage. We have the courage to tell people not to throw garbage when we see them, not to cut trees. I have gained courage to speak up for things like this. So indeed, there were numerous challenges within the scope of this work. There were technical challenges, there were a lot of pragmatic challenges, as well as ethical challenges. But what I want to point out is that engaging in critical reflexivity helped the research facilitators as well as child co-researchers navigate some of these ongoing tensions. And it didn't mean that we found the right solutions, but rather helped us understand where these issues stemmed from and what might be the ways forward to address it. So I can maybe share a couple of these issues and how we work towards navigating that. For example, there were technical issues related to storyboarding. So a key piece of a participatory filmmaking process is the community members are involved in a storyboarding activity where they use paper and pencil tasks to draw out the different frames that they would like to see within their film and what they would like within each frame. But within the context of this work, some of the children involved were out of school, and they experienced issues of marginalization within their school setting. So they were not comfortable with using paper and pencil tasks. They refused to use paper and pencil tasks. So we had to use a more dialogic approach to story sharing and generating information on issues that they wanted to share within their film. So this dialogic approach had to be adapted to fit the context. Similarly, I can maybe speak about some issues related to authenticity. So children with disabilities, when we met with them and we asked them, what are some issues that you want changed? They kept bringing back community issues such as garbage accumulation, issues related to deforestation, and initially rarely spoke about issues that they faced on an individual level. But when I went into this project, I was thinking that children with disabilities were often going to share about issues that they faced related to their disability status. So my co-facilitator and I had to come back and discuss, like, why is this happening? Is it some of our implicit assumptions that children with disabilities are only going to speak about issues at the individual level? I mean, they are responsible citizens as well, and issues of justice can also be collective issues. It doesn't have to be individual issues. So it challenged some of our implicit understanding about the positioning of children with disabilities. So the co-facilitator and I regularly met together and engaged in shared dialogue and reflexivity, asking each other questions about what went well, what were some challenges that we faced, what do you think informed such challenges? Are there some cultural norms? Are there some pre-assumptions that we are carrying that position these issues as challenges that need to be addressed? So we engage in critical reflexivity very regularly to navigate some of these tensions that were constantly emerging in the field. We also engage in shared critical reflexivity with child co-researchers. For example, there were issues related to the risk of sharing truth. And so when we engage with child co-researchers about how they would like the video to be disseminated, they clearly articulated that they could do in-person dissemination with village leaders and maybe families and immediate neighbors, but they didn't want an in-person dissemination with teachers within the school setting because they thought that it could lead to issues of risk when they go back to school. They could be further marginalized. So they requested that we could upload the video online and then share it with people who maybe teachers within the village or teachers outside of the village, and they wouldn't exactly know or identify who was involved in making this project. So, so I just want to point out that critical reflexivity helped navigate tensions on an ongoing basis. And so I would like to conclude by saying participatory filmmaking was a useful methodology for enacting inclusive and transformative research, and combined participatory as well as theoretical analysis facilitated understandings of the complex and the situated nature of everyday injustices. And transformation is ongoing, and that intentional follow through is necessary, and it doesn't, the action phase doesn't abruptly end. It is always ongoing, and people who are engaging in power work need to embody that responsibility to continually work towards a transformation that is aimed at. Open to any questions. I think there is some time.
Thank you so much, Tanya. Liana, I think, were you going to say something before I step in to share some?
Yes, yeah, really just quickly. Just want to thank you, Tanya, so much for the incredible presentation and showing us the film. I know I will definitely be checking the full video out after this presentation. So just a reminder to everybody else that the link is in the Zoom chat for the full film. And I think I speak for many people here today when I say that I learned a lot in the last 40 minutes or so. So thank you once again, Tanya, for being a part of session 2 of our Methods for Global Health Equity webinar series. Our next session will be on March 31st at 12 p.m. and the same Zoom ID will be used there. Next session's theme is Institutional Ethnography and Health Services Research with Eugenia Canas from Western University. Okay, so before I pass it on to Dr. Nouvet, who will be moderating the Q&A session, I just want to remind everyone once again to complete the link, complete the quiz linked in the Zoom chat to receive a certificate of attendance for today's session. So thank you all for listening attentively. Dr. Nouvet, I'll pass it on to you for the Q&A.
Thank you. And thank you very much for the presentation, Tanya. Very eloquent and also really a good overview of participatory action research in context. I do want to open it up for questions, and I just see that there is a comment from, I'm going to ask Mary Nadeau to share the comment and question she posted in the chat some minutes ago.
Okay, thank you, Dr. Nouvet. Tanya, thank you so much. Actually enjoyed it. I came in late, but at the point I joined, it was quite interesting listening. Then getting to watch the clip itself kind of resonated with me because it's an experience I've lived. So I could relate to what the boys were saying, especially the one using glasses. I mean, I grew up hearing people call me for eyes, binocular eyes and all that. So it's something I could relate to. But one of my experiences was that the adults around me also kind of contributed to that because they also took part in calling me for eyes, binocular eyes, and all those funny names. So I was wondering, in your interaction with the adults in the community, did you get to kind of get a sense of their position on that, where they're also contributing? Because children learn from adults. It's what they see the adults do, they transmit. So I'm wondering if there was that kind of knowledge came out in this, that the adults themselves were somehow contributing to it.
Yes, I think that's a very important point that you brought forward. And so when discussing with children about these issues that they brought forward, so that the child co-research has actually shared that some of the issues that they're articulating was not just experienced by children. It was, and not just by children with disabilities, and that teasing and bullying was seen across the school, where children were teased if they were short, if they were tall, if they were dark, if they were fair, if they wore glasses, if they had an assistive device, and if they were girls. And they also specifically articulated that adults do engage in this behavior and that children are learning from a context where violence is prevalent. So I think children definitely articulated all the contextual forces that contributed such situations that they were experiencing. And in turn, some of the solutions they articulated was not just health education. They said that children and people involved in this behavior need to experience and feel what it feels like. So they called for actions that actually require more simulation rather than just a transfer of knowledge from people who are maybe in the healthcare institution to students.
Thank you very much. That was going to be my next question on what happens after that dissemination. Did the community come up with like a solution on how to address it? But you've answered it, so thank you so much. I appreciate that.
So in terms of the solution, I think sustainability is a very important part of participatory action research, and that's why this PAR was actually carried out in collaboration with a local institution that is already doing work within these communities, had the human resources, but they weren't they hadn't worked with children with disabilities as co-researchers. So I think some of these issues brought forward actually further mobilized the local institution to take on such initiatives. And so, as I mentioned earlier, a tree planting program has already begun. And some of these issues still require a lot more in terms of needing to mobilize change. So they are actually some of my interests as I develop my career, to work towards some of these anti-bullying projects. And I'm also actively looking at local nonprofit organizations who might be interested. And some of the nonprofit organizations are interested, but again, there are barriers to funding, and the pandemic came up. So it's an ongoing process.
Yeah, I agree with you. Thank you so much.
Are there any other questions? I do have several myself. I see one though from Chulin Zhu. Did you want to go ahead?
Hi, Tanya. Thank you for your presentation. It was really insightful and I definitely learned a lot. And I know you just kind of touched on some of the solutions that were being implemented. And I was wondering if you can speak more on how the research, how the information collected from the research is being used to inform these interventions and kind of mitigate the issues that were identified.
Okay. So I think as a first step, the dissemination of the video to community leaders brought forward a lot of sensitization among these community leaders. And so a lot of them weren't aware that there was a lot of garbage being accumulated within a lot of these public wells within the village. So they are going to take efforts to actually work with the community members and actually preventing them from throwing garbage. But child core research has also articulated that it wasn't an issue at the individual level. There was a lot of corruption and politics involved in that. The garbage collection vehicle doesn't necessarily come to the interior of the village. It actually goes only on the main roads, and only when the village leaders are visiting the village, they actually come and clean it. So I think issues related to corruption are something that is hard at this point to address, but it was at least brought forward. And the local institution I worked with actually provided a lot of suggestions, such as should they install garbage bins beside every shop that's present. But again, there were community members who were involved in the meeting who had different thoughts for different issues. So I think if there were garbage bins produced, then they might be used in a different way. They may not be used to collect garbage. So there were a lot of issues brought forward. And but I think but even though there are barriers to mobilizing change or moving forward, some actions have been implemented, like the tree planting agenda. Then issues related to teasing and bullying was actually not a part of the health education program that the institution was doing. But because this issue was brought forward by children, it has been now included within the program that's not only carried out within this village, but also the other 85 villages that they are a part of. And there was also a transformation, I think, for some of these children at the individual level. They required a lot of assistance with their assistive devices, and they were able to work with the local institution to get some of that for free. So yeah, I think working in collaboration with a local institution creates a space for sustained work towards addressing that transformation. So it's not me going in and just leaving, but rather there is continued efforts to sustainability. I hope that answered some of your questions.
Yeah, thank you. I really like that the awareness was raised and that led to real sustainable change. So that's great to hear. Thank you.
Thank you.
Thank you. We have a question from Gojan. Gojan, do you want to, okay, she says she can't talk but it's in the chat. Thank you, Tanya, for the great work. Most of the issues you find are really embedded in the social cultural environment and the societal views about disability. I wonder what policy environment are active to curb the problem, even at the small scale level.
That's a hard question to answer, but definitely issues of disability are shaped by the social cultural environment. So even issues that were brought forward were like children with disabilities, because of myths and cultural understandings of disability, were given a burn in one year, were poked in one year to address some of the myths associated with disabilities. So there is ongoing health education about disability and what are the outcomes of disability. But I think this work, specifically because children with disabilities were involved as co-researchers, they challenged that position of children with disabilities as being incapable. So when they actually spoke to the healthcare providers, a nurse articulated how she had no idea that children with disabilities could actually do something like this. And she thought, even though she was a healthcare provider, it challenged some of her implicit understandings of the positioning of children with disabilities. And so we hope that some of this work would inform policy, but I think at this point it is working one step at a time. It worked to challenge perception of local village leaders and the institution we worked with, which in turn informed the kind of work that they are doing within this community. And hopefully as people start to engage in this discussion more, there could be changes at the policy level.
Thank you, Tanya. I'm going to step in with a question because I have several and I just want to get one in. So I'm really interested in research ethics, and I also have a master's in visual anthropology. So I've done participatory theater work. So there's kind of there's the last bit you talked about where the children wanted it uploaded to YouTube, and we're worried about the risks of maybe teachers seeing it and risks. I'm just wondering if you could say a little bit more about that, because I think that that's, yeah, like how did you think through that, and how does one decide to proceed? And would they really be anonymous? I assume they were going around the village with cameras filming, so I guess everyone would know who made the film. So what are, I mean, this is something we could totally face, any of us who are using this approach.
For sure. So that was the reason children didn't want it to be disseminated within their community. So the in-person dissemination happened right when the project ended, but the virtual dissemination happened at a later time. And so then a link was shared with these children, basically with the parents, and then they had the opportunity to share it with whoever they wanted. And so they might have shared it with the teachers, we don't know. But when children actually captured videos, they captured everything in a way that was not identifiable. So even streets. So when they actually looked at the video, when they were reviewing the editing during the editing process, they said, oh, this street, people would know it was taken in this village. So maybe we should change the clip. So it was more taken in a way that it's not very easily identifiable. So even specific locations were not identifiable. So it was not just faces or eyes, but also locations. So I think that kind of helped with that. But we haven't obviously heard back. So I am still in touch with the local institution and heard any negative things back from either the school or from the children or their families. So I think, yeah, it was, it took some time because even the first dissemination didn't have my voice in it as a co-facilitator. I had to navigate some of that because I didn't want my voice to overpower what the children were saying. But they kept, after the dissemination, the child co-researchers kept saying that, oh, we want you to also to be involved in this, in the video, like, because you were part of this project as well. So then I spoke to them about, okay, maybe I can speak about the process and how we did this. And then there was also this tension about how do we represent children? Should I call them children with disabilities or children with special needs? How did they identify themselves? So there were a lot of tensions that came up, but again, I went back to them to ask them what they were best comfortable with.
Yeah, okay, thank you so much. It's really fascinating and it is challenging. There was a question posted in the chat, but Allison left, and so she was asking about informed consent from children and caregivers. I know you did talk a little bit about going over orienting them to the whole research ethics framework.
Yes. So initially we had a recruitment meeting, and during which we went through the entire informed consent process. And there were some parents who did not want their children to be involved, and some parents who did. So, so again, they had time to go home and decide if they really wanted to be involved. And if they did, they, after I think 2 weeks, they were invited for the meeting, the first meeting. So some came back, some did not. And then after that, I had a separate session with children where we went over all the information about this project, and it had specific pictures. So it was child friendly as well as culturally relevant. So children understood about the process and what was expected for them. But overall, children really enjoyed the process, and they were really excited to do more work. They suggested other ideas to explore, and then they were really motivated to continue work in this.
That's fantastic. Thank you so much. And it's always reassuring when some people don't come back, right? That means you've done your consent information right. They're making a choice. I think that is, we have lost quite a few participants, so I think we should wrap it up. But thank you so much for sharing your amazing work, and for a presentation that was really clear and elegant. Thank you.
Thank you, Alicia, for the opportunity.
And everybody else who's still here, thank you so much for attending, and I hope that we see you in a month for the next one.